This is Caritas Nigeria, the Catholic Church's development fulcrum, which accords everyone equal opportunity to enjoy fullness of life, regardless of tribe, creed, status, or gender. The bedrock on which the well-being of all is advanced through participatory measures in line with Catholic social teachings. This atmosphere is devoid of ignorance, deprivation, injustice and hunger, an environment where option for the poor, stewardship, sacredness, and dignity of human person are of utmost importance. Together, let us explore the beautiful horizon which Caritas Nigeria aims to create by bringing succor to those in need and promoting human dignity. The Catholic Caritas Foundation of Nigeria, also known as Caritas Nigeria, was established in September 2010 by the Catholic Bishops' Conference of Nigeria as the specialized national development agency with a mandate to coordinate relief and development programs of the Catholic Church in Nigeria. Caritas Nigeria is a member of Caritas Internationalis Confederation, a network of 165 member countries, providing relief and human development around the world. Caritas Nigeria, an arm of the Church and Society Department of the Catholic Secretariat of Nigeria, CSN, is under the jurisdiction of the board chairman, His Lordship, Most Reverend Lucius Iwejuru Ugoji, and the executive secretary, Chief Executive Officer, Father Evaristus Bassi. This specialized agency constantly seeks to build a harmonious environment, a peaceful world without deprivation, where everyone attains his or her full potentials and enjoys life to the fullest.
Caritas Nigeria, as I mentioned, is for coordination. It doesn't really implement, because you must realize that the way the church is structured, the power is at the grassroots, so the dioceses, the parishes, the center is just for coordination. We work with the dioceses. Each diocese in Nigeria is supposed to have what they call a Justice, Development, Peace and Caritas Commission. So these are our direct partners in the dioceses.
Since her establishment, more than 4 million persons have benefited from its developmental projects across the 36 states of the Federation and the Federal Capital Territory. Caritas Nigeria has over the years rendered interventions in several thematic areas of focus. One of it is the health and HIV/AIDS care and treatment. Dr. John Okpanachi Oko is the principal investigator, Caritas Nigeria's new program, Paul Gates, Global Action Towards HIV Epidemic Control in Sub-National Units in Nigeria, and was the program director of the United States government-funded SUSTAIN project, which was aimed at reducing morbidity and mortality of HIV incidences in Nigeria through the provision of care, treatment, and support to HIV-positive clients, prevention services, and support to vulnerable children across 12 states in Nigeria.
SUSTAIN is Sustained HIV Care Treatment Action in Nigeria. It was a 5-year comprehensive care and treatment project that was funded by the President's Emergency Plan for AIDS Relief through the Centers for Disease Control and Prevention. These are agencies of the United States government. What we did under the SUSTAIN project was to help hospitals to provide HIV care and treatments to as many persons that were infected and affected in the various communities and states.
The Catholic Church in Nigeria has 1,384 health facilities spread across the nation, especially in hard-to-reach areas. Caritas Nigeria has supported 133 health facilities, including facilities owned by other faiths, where health care services and humanitarian support are provided.
When the 1210 projects that were funded by CDC in 2012 started, there were 5 implementing partners that were selected, and Caritas Nigeria was one of the organizations that was given this grant. And our responsibility then was to focus on in faith-based hospitals across the 12 states, across all the states where CDC was implementing HIV care treatment action. So for us, while the other organizations were working with government hospitals and all that, our responsibility was to work with faith-based hospitals only across these 12 states. And so that kind of formed the basis for our intervention across the states. What we did was to first identify all the faith-based hospitals that were providing HIV care treatment activities before the project started, before the award was paid. And then we also identified other potential hospitals that could provide HIV care treatment services.
With its strategic plan employed, one cannot but say that Caritas Nigeria is better positioned to carry out these interventions.
Faith-based hospitals kind of did very well in terms of their availability and willingness to provide, quality care and treatment services. But there was a lot we also had to do to ensure that these hospitals can continue to provide quality services. Our approach was beyond helping them to initiate and put patients on treatment. We were focused on capacity building across all the intervention areas, from treatment, prevention of mother-to-child transmission, TB, HIV, orphans and vulnerable children's programming. We also ensured that they had basic supplies that they require to ensure that they can also provide these quality services. And we also did a lot of infrastructural development, from ensuring that the outpatient departments where these patients were seen were conducive, and for them to see patients, we refitted and renovated a number of outpatient departments and labor wards, labor rooms, and also the lab particularly was one area where we kind of really intervened in trying to renovate labs to ensure that the labs could provide and do quality investigations that back up.
This is a comprehensive ART training, ART antiretroviral therapy training, and this is specific for doctors. Well, of course, we've had a lot of clients from my site come for training and all that, but I would say this was very comprehensive. Apart from knowing what I'm supposed to do as a clinician, I also have at least an idea, at least a basic idea, an idea on what each and every person in the facility is supposed to do. Well, for me, this training has been impactful. Okay, I've been able to have an in-depth knowledge.
ESTA project means Integrated Intervention for Sustainable Testing and Retention, focused on HIV positive pregnant women. What we tried to do in that project is to first to ensure that as many HIV positive pregnant women that are out there are identified, they are put on treatment, and they are retained on treatment to ensure that they can achieve viral suppression over a period of time. It's actually a research project, and the grant was won by the University of Nevada, Las Vegas. So essentially, we are sub-grantee implementing the project in Benue.
On the other hand, Caritas Nigeria's humanitarian and developmental responses in the northeast and north-central regions of Nigeria have been enormous. The regions have been devastated because of insurgency and attacks by herdsmen, necessitating the migration of the indigenous people of these areas to internally displaced people's camps, IDPs. Most of these IDP camps are present in the Federal Capital Territory and in Adamawa and Borno states. The major focus of Caritas Nigeria interventions have been the provision of food items, water, sanitation and hygiene, agricultural inputs, education, healthcare, and nutrition services. supporting over 102,000 direct beneficiaries with relief materials and services, and over 1 million indirect beneficiaries with services in host communities. These interventions were funded by the Catholic Bishops' Conference of Nigeria, Caritas Internationalis member organizations, as well as aids from governments of some countries, United Nations agencies, and individual philanthropists.
For the past 4 years, we've been intervening in the Northeast, as well as in other crises as they arise in Benue, in Jalingo, in Kaduna, based on fundings available to us. We launched an appeal where we intervened in water, sanitation, and hygiene. We were able to construct solar boreholes in Adamawa State into local government, Yola South, and in Jere. We were also able to rehabilitate hand pumps and electric motorized boreholes. We were able to carry out training of trainers on peace building and psychosocial support. We were also able to do a bit of health intervention where we supplied medicine as well as medical training to a health facility at St. Teresa's camp. We had to recruit health personnel, doctors, nurses, community health care extension workers, train them, set up mobile clinics as well as temporary clinics, do mobile outreach. We were able to recruit nutrition experts as well as nurses.
Beyond the Northeast, Caritas Nigeria has responded extensively to food insecurity, education, water hygiene and sanitation in the Sahel region of Sokoto, Zamfara, Katsina, and Jigawa states. These interventions were funded by Caritas Internationalis, the Catholic Relief Services, and other development partners.
We've been able to do agri-input fair for over 1,000 persons, in which case we were able to select the most vulnerable beneficiaries, and then we organized an agri-fair based on the kind of seeds and farm inputs that the communities requested for. And we were able to get it at a discounted rate, and we offered vouchers to the identified beneficiaries, and they were able to plant. And right now some of their plants are nearing maturity, and we've also organized another training. It's called for the post-harvest, so that they are able to store their crops properly, so their crops, when they harvest, don't just go to waste or they sell it at whatever giveaway price. We've been able to get some fundings locally from Union Bank. Union Bank has been able, through their staff contribution, been able to support a health project whereby in renovating some hospitals in southern Borno, as well as providing medical equipment. They've also been able to provide fundings to renovate 2 primary schools, 2 blocks of 3 classrooms each in Hong and in Gombe, all in Adamawa State, as well as supply over 500 3-seater desks and chairs to pupils in the schools. In all our project implementation, we try to mainstream eco-friendly technologies, environmentally friendly techniques, environmentally friendly principles, and how to sustainably keep the environment. For instance, I talked about the water, sanitation, and hygiene. You kept hearing me talk about solar powered. We are trying to use the natural energy to power water supply. That's an environmentally friendly initiative. We are distributing solar lanterns. That's still being environmentally friendly. We are also trying to use environmentally friendly stoves. These are stoves that would ensure that you do not use so much firewood just very little, minimal, and it's made from earthenware and it's made locally. We are training farmers and beneficiaries on how to prepare organic manure using natural things. We are also training them on how to use natural things to prevent pests, and even in their storage, their post-harvest management of their farm produce. So we try to incorporate environmentally friendly techniques and principles and mainstream it in all our programming.
Thank you, Mr. President, my distinguished colleagues.
On governance, Caritas Nigeria works to strengthen citizens' participation with a view to ensuring accountability and good governance in Nigeria. Caritas implements both at the national and diocesan levels through advocacy with the relevant structures, capacity building for stakeholders, election observation and monitoring, media engagement, as well as budget monitoring. Presently, Caritas Nigeria is collaborating with the Diocesan Caritas, that is, the Justice Development and Peace Commission, JDPC, on advocacy to the legislative arm of government to promote good governance and services to the people. The Good Governance Program area, on its own, addresses issues around integral human development using the structures of the Catholic Church in Nigeria.
We're able to do voter education and also actually observe the elections. UNDP also supported a project in Cross River. It was an anti-corruption project, and we're looking at the procurement system. And Cross River still happens to have a procurement law, so we used that law and we worked with the government, monitored the procurements in government. We were able to come up with a platform, an online platform, in which people could report infringements, and then we had a relationship with ICPC, in which we could report what we had on those online platforms back to ICPC.
In collaboration with NAPTIP and other relevant anti-human trafficking agencies in Nigeria and around the world, Caritas Nigeria has organized several sensitization programs aimed at curbing trafficking in persons within and outside Africa.
It is an eye-opener for many of us listening to the survivors of human trafficking and the different organizations and faith communities working for the sake of the survivors and working also to eradicate it. My mind got blown away. I have heard many times about the problem, but coming to this conference, I realized the magnitude of the problem.
Nigeria is a source country. Even though it's also a destination and a transit country, but it's majorly a source country. We try to carry out campaigns, preventive campaigns, sensitization campaigns. We go to churches, we speak at mass, we go to even gatherings, community events. We hold conferences. We had an interfaith conference on anti-human trafficking in Benin, Edo State. Keep sensitizing people and also see how we can carry out advocacy to the government, because a lot of times people are being trafficked because they don't have the basic necessities of life. Things are hard, things are difficult, poverty is huge, and that is a driver on its own, aside from greed and other factors.
The PMP training program is one training program that Caritas Nigeria, I think the first organization to initiate to start training in Nigeria. We got the support from Catholic Relief Services, where a number of our staff were trained, and then they are trained as trainers. So we've been training all Caritas Nigeria staff are PMD Pro certified, which means that the basic principles of project management for development workers are things that we really utilize. So we are training people to ensure that they can understand basic things. I mean, of course, you know that there are a number of project management trainings out there, but the unique thing about the PMT Pro training is the fact that it is tailored towards development workers.
When I heard about the PMD Pro course from an acquaintance, it particularly appealed to me because it offered me an opportunity to improve my project management capacity. And I've, of course, learned about how to use new tools, methodologies, techniques to make my work easier, to deliver my project better now. And of course, now I believe I can easily identify challenges and manage project challenges to ensure overall success of my projects.
However, a major challenge which Caritas Nigeria is faced with in program implementation is the donor dependency syndrome. If only the Nigerian government could own the response through adequate funding and collaboration, Caritas Nigeria's efforts in providing comfort to humanity would be better strengthened, and the poor in our society loved with deeds, not words.
I'm seeing a few things in visits to other countries and the way the governments of other countries, even African countries, you know, when they have problems, the way we could face those problems and tackle those problems, we lack those push most of the time in Nigeria. A lot of other countries can run their HIV treatment program conveniently, but that's not the case with Nigeria.
The federal government established the PCNI. I don't know what the PCNI is doing. They are not open really to faith-based organizations like us. Even as we are very neutral and we don't proselytize, because in our own values we are not allowed to proselytize. I think there's a lot of prejudice in PCNI, which excludes organizations like our own. The federal government says it's doing a lot, it has voted a lot of money, but I don't really know what it is doing. I just wish that there could be greater coordination and less suspicion of one another, so that the resources that are available, the actors that can do this work have access to these resources and